Hey everyone, welcome back. Today we're going to be doing kind of a deep dive into the world of observation and charting for
Right.
nurse assistants. And
Big stuff.
yeah, big stuff. We're going to be using Model 15, observation and charting from the California Community College's Nurse Assistant Model Curriculum. It sounds,
It's a mouthful.
yeah, a little
Yeah.
bit.
Yeah.
But I think this will be a really cool deep dive just to kind of see how they approach this.
It's a great resource.
Yeah.
It really is. We'll be talking about everything from
Yeah.
understanding medical terminology to mastering the MDS, like the minimum data set that you use in long-term care settings, like the whole 9 yards.
Oh, yeah. I've got to admit, like the medical terminology stuff,
They give you a little
it's always a little bit intimidating. I feel like it's
Yeah.
like a whole other language.
It is.
Yeah.
But that's what this curriculum does.
Yeah.
It breaks it down. It's like learning a code once you
Wow.
understand like prefixes,
Yeah.
suffixes, and root words. You can unlock the meaning of even the most complex medical term.
Right. So like I saw in here, they say like Brady means slow and otitis means inflammation.
Right.
So does that mean like pretty much every medical term is just kind of like a puzzle of these pieces?
Often.
Okay.
It is. I mean, like you take Brady means slow.
Yeah.
Otitis means inflammation. You put them
Huh?
together. You got bradycardia,
Oh.
which means a slow heart rate.
Oh, okay.
Yeah.
So it's like detective work almost.
Yeah. I like that.
Yeah, like figuring out the clues to understand the bigger picture.
Yeah. And once you crack the code of medical terminology, you'll be able to communicate more effectively with the whole healthcare team.
Right. And I also saw they had a whole section on medical abbreviations.
Yes.
And there's a few that I know, but there's some that I always get tripped up on, like ad lib. I know it means as desired. But like,
Where'd it come from?
yeah, where does that come from?
So it's from the Latin phrase ad libitum.
Okay.
Okay.
Oh.
It means at pleasure. So like if you see ad lib on a medication order, it means the patient can have it whenever they want or need it.
Oh, so it's like giving the patient a little bit more
Yeah.
control over their care.
Absolutely.
Okay. And then they also have print in here, which I always...
Another Latin abbreviation.
Yeah.
It stands for pro re nata.
Okay.
It means for the thing that is born.
Oh, for the thing that is born.
Right. In medical terms, it means that you give something only when a specific need arises, not on a fixed schedule or anything.
Oh, okay. So when you see print,
It means you're going to give it.
yeah, it's not like a regularly scheduled
Yeah.
dose. It's like...
It's like if they need it, if
Yeah.
they have the symptom or whatever.
Right. Okay, I get it.
That makes sense.
And so speaking of giving care, let's kind of move on to the observation section.
Yeah.
Which obviously I feel like as a nurse assistant, that's probably the biggest
Yeah.
skill you need, is to be able to
The most important.
really observe your patients.
Yeah.
Because they really emphasize in this curriculum, like
You are.
the eyes and ears of the healthcare team.
Yeah, you're it.
Yeah.
Because-
They're like a detective, kind
Yeah.
of constantly gathering clues about a patient's condition.
Absolutely. And those clues can be very subtle, like a change in skin color, a new cough, even a shift in their mood can all be an indicator that something might be wrong.
Right.
You know?
So how do nurse assistants actually like make sure they're catching all these subtle clues? Because they mention using like all four of your senses, like sight, touch, hearing,
Smell even.
yeah, smell even,
Yeah.
which is kind of interesting.
Sight is obviously like very important. That's how you assess the patient's appearance. Things like skin color, their posture, any visible signs of injury or illness.
Right.
Touch. That's how you figure out like their temperature, their skin texture, their pulse, all that stuff.
Yeah. And then hearing, I feel like, is a big one that people maybe don't always think about. Like you might hear a change in their breathing, or they start coughing, or even like a change in their voice or something like that.
Could be a problem.
Yeah, that could be something.
Yeah.
And then smell. Like I never really...
That's a powerful one.
Oh, really? Yeah.
Certain medical conditions can have distinct odors that could be like, whoa,
Oh, wow.
something's wrong here.
That's interesting. So it really is like all your senses that you're using
It is.
to observe a patient.
All 5.
Wow.
Yeah.
And they actually have something called, they call it the ABCs of observation, which I
I like that.
like that.
Simple and easy to remember.
Yeah.
So A is for appearance,
Okay.
B is for behavior,
Okay.
and C is for communication.
Okay. So appearance, I feel like that's kind of like what we were talking about, like using our senses to see like how they look.
Yeah.
What about behavior?
Okay, so that would be like their level of alertness, their mood,
Right.
and any unusual movements or actions.
Oh, right. Like if...
Are they withdrawn?
Yeah. Are they agitated?
Are they moving around normal? Are they having difficulty with their balance?
Yeah. Yeah.
You know?
Okay.
Stuff like that.
Yeah. And then communication, is that just like what they're saying to you, or is it?
It's more than what they're saying.
Okay.
It's also how they're saying it. Their tone of voice, facial expressions, body language
Right. Because sometimes what they're not saying
is just as important as what they say.
Right.
And even subtle changes in these areas can signal a change in a patient's need.
Right. Okay. It's a lot to keep track of.
It is.
But
that's why it's so important.
Yeah.
Yeah.
You really have to be on top of it as a nurse assistant.
It's a skill that takes practice and attention to detail.
Yeah.
But once you master it, you'll be able to provide truly individualized care.
Okay. Now, once you've gathered all this information through observation,
Yeah, you got to document it.
you've got to document it,
Yeah.
which is
charting.
charting. And there's a key distinction, right, in this. They talk about objective
Yeah.
versus subjective observations.
This is where it gets tricky if you're not careful.
Yeah.
Objective observations are based on facts and measurements. It's stuff that you can see,
Yeah.
hear, touch, smell.
Right. So like their temperature,
Right.
pulse rate, amount of fluids they've had.
Right. It's like evidence that you would present in a court case.
Yeah.
You know, it's based on what you can observe and measure.
And then subjective is based on like what they tell you. Like they're feeling nauseous, they have a headache.
Right. Which is important information,
Yeah.
but you can't necessarily measure or verify that on your own.
Right.
Yeah.
So you have to document those observations like in a way that
That reflects their
perspective.
Yeah. Like
Yeah.
they say, patient states, I'm feeling dizzy or something like that.
You got it.
Okay. So it's really about just making sure that what you're writing down
Yeah. It's accurate.
is accurate.
Yeah.
And reflects their
Feelings and not like you're trying
your
to.
interpretations.
Yeah, exactly.
The biases
Yeah.
shouldn't be in there.
Right. And they have some good examples, like measuring a patient's temperature is objective because you're using a thermometer to get...
Concrete reading.
Yeah. But if a patient says, I feel cold, that's
objective.
objective.
Yeah.
Okay. So that's a good example there.
And they're both important, though.
Yeah.
Both objective and subjective.
Yeah.
Because you need both to get the full picture.
Yeah, I got it. Okay. Now, we've gathered all this information. We understand the difference between objective and subjective. Now we actually have to chart it. So what are the different...
The process of charting.
Yeah, like
Okay.
what are the different documents that...
Just blind assistants use.
So they talk about the patient care summary,
Oh, okay.
sometimes called the care plan.
It's like a roadmap for the patient's care.
Oh.
And it summarizes the physician's orders, critical data like allergies and code status, and then it has information about their medications and treatments.
Oh, so it's like
Just
a
a quick
reference guide for everyone involved.
Exactly.
Gotcha. Okay. What else is there?
Then they have the nursing care plan, which is more from the nursing perspective.
Okay.
And this one outlines the patient's needs and lists specific nursing activities to address those needs.
Right. So that everyone's kind of on the same page.
Consistent.
And there's a consistent...
And personalized.
Yeah, personalized plan in place.
Yes.
Okay.
Some facilities use a graphic sheet
Okay.
to document vital signs, intake and output, weight,
Okay.
and then there's the ADL sheet, activities of daily living.
Okay.
Yeah.
And that's like a...
That's where the nurse assistants shine,
Yeah.
because this provides a detailed picture of the patient's level of independence and the assistance they require for activities like bathing, dressing, eating, toileting, all that.
Right. And that helps to determine like what level of care they need, right?
Absolutely.
Okay. Okay. And then they also mention a big one here, which is the minimum data set or the MDS.
Big stuff.
Yeah. This sounds like...
That's a standardized assessment tool that's used in nursing homes. It's mandated by federal regulations, and it's what's used to determine reimbursements from Medicare and Medicaid.
So it's not even just about like
It's not.
giving good care. It's about
It's about documenting it.
document it in a way that meets
The feds.
the standards. Okay. And the MDS, I mean, it covers a whole bunch of stuff, but they really focused on Section G,
Right.
which is physical functioning and structural problems. And this is where, like, the ADLs come in, right?
Right. Because what they do is they use Section G
Yeah.
to assess a patient's ability to perform activities of daily living.
Right.
And they use a standardized coding system to reflect their level of independence.
Right. I saw that coding system. It's very...
Very specific.
Yeah.
It's very detailed. The codes range from 0 to 4, with 0 representing complete independence
Okay.
and 4 representing total dependence.
Okay. So, like, a 0 would be
0, they could do it.
they can just do it on their own. Like, they can bathe themselves, dress themselves.
Get in and out of bed,
Yeah.
have themselves.
No help.
Yeah.
Okay. And then a 4 is like...
4, they're completely dependent. Like, They're bedridden,
Yeah, they're bedridden, they can't move, nothing.
can't do anything.
Right. And then there's like a 2 and a 3 in there?
Right. So 2 is limited assistance,
Okay.
and 3 is extensive assistance.
Okay. So a 2 would be like maybe they need help with like one part of it, but they can do the rest.
You're like reaching their back to wash it when they're taking a bath.
Okay. Okay. And then a 3 is?
3 is like they need a lot of help. They can participate,
Yeah.
but they need physical support from staff.
Gotcha. Gotcha.
Yeah.
Okay. Okay. And so these codes really determine
They
like
do
what kind of
care.
they get.
Right.
Big time. Wow.
Yeah, like whether they can stay at home or if they need to go to a skilled nursing facility or whatever.
Yeah. And then there's this other thing. They call it assessment reference day
ARD.
or ARD.
That's the end of the assessment period.
Okay.
But the thing is, they actually do the assessments during the 7 days preceding the ARD. That's called the look-back period.
Okay. So if ARD is like, let's say, January 8th,
They're looking back at the 2nd through the 8th.
they're looking from January 2nd through the 8th. And
That's where all the good observations
Yeah.
and documentation needs to be happening.
right. Okay. So it's like prime time to be super vigilant
Yeah.
and paying attention.
Absolutely.
Okay. And speaking of that,
Accurate documentation.
yeah, let's move on to like best practices for charting.
Yeah.
Because they're pretty
They really are.
meticulous in here
Mhm.
about like record keeping and all that. So what are some key things that a nurse assistant should keep in mind when they're doing this?
So first of all, make sure you got the correct chart or ADL sheet.
Yeah, you don't want to be charting the wrong person.
No.
Yeah.
And then legibility.
Oh, yeah, that's a big one.
Huge.
Yeah. Like, I feel like when you're in the heat of the moment,
It can be tough.
yeah, it's hard to have perfect
Yeah.
penmanship.
They recommend that you actually write notes on paper first
Oh, okay.
to kind of get your thoughts organized, make sure the spelling's correct,
Yeah.
that it's accurate,
Oh, that's a good idea.
and then you transfer it
Yeah.
to the official chart.
Yeah, like a rough draft kind of.
Exactly.
Okay, one.
Ballpoint pen with black ink only,
Okay.
no pencils, no felt tips,
Yeah.
no other types of pens, no colors. Unless the facility's policy says that's okay,
Black ink only.
black ink only.
Okay. I guess then there's a good reason for that.
There is. It's permanent.
Oh, yeah.
It's less likely to fade or smudge over time.
Oh, okay. What if you make a mistake? Because I feel like
we all
everyone makes mistakes.
Yeah. There's a way to correct it, though. So you never erase, you never use whiteout.
Okay.
You draw a single line through the incorrect entry.
Okay.
Write the word error above the line.
Okay.
And initial the correction.
Okay. Easier now.
Right. And then always include the patient's complete information on each page of the chart.
Okay.
So like their name and any other required information as dictated by the facility's policies.
Okay, so no cutting corners when it comes to patient information.
No.
Yeah.
And never skip lines when you're charting.
Oh.
Each entry should follow the previous one chronologically.
Right.
So you have a clear and tamper-proof record.
So it's very, like, precise and deliberate.
It is.
Yeah.
And then when it comes to signing your entries,
Oh.
make sure you sign your name and your title,
Okay.
like J. Jones, nurse assistant, or R. Smith, NA,
Right.
and always date and time your entries.
Okay, so really just making a clear, accurate, and, like, in order.
Chronological.
Yeah, record of everything.
Right.
Okay. And one of the other things that I saw in here that I said is only chart procedures that you have personally performed
Yeah.
and only after you performed them.
Right. So no
Okay.
charting ahead of time.
Yeah.
No documenting things that you didn't actually do.
Yeah. So if someone else did something,
You're not charting it.
you're not charting it.
Yeah, charting's about accurately reflecting what happened.
Yeah.
You're not making up
okay.
a story.
Exactly. Exactly. Okay. What about, like, opinions? Like, if you think a patient is being, like, difficult or uncooperative or something like that, can you, like, write that down?
Nope.
No.
Charting should be based on objective data, not opinions. Stick to the facts.
So instead of saying something like, patient seems to be in pain, you'd say something more.
More specific,
Huh?
like patient is grimacing and holding their abdomen, reports pain level of 8 out of 10.
Okay. Yeah.
That would be better.
So more specific.
Okay. And then
If they say they're feeling feverish,
you actually check their temperature
check the temperature. Write it down.
and write it down.
Yeah.
Okay. So they were talking about like charting on paper. But obviously computers are being used
Yeah. More and more.
more and more these days. What
Right.
about,
They do touch on that a little bit.
yeah, what about that?
Yeah, computerized charting
Yeah.
is becoming more prevalent, but
Mhm.
the basic principles of charting still apply.
Yeah.
Confidentiality and accuracy are super important, just like with paper charting.
So even though you might be tipping it into a computer, it's the same
Egregious.
level of like care and
Detail.
yeah.
Yeah.
Okay. And they say that like a lot of these computer systems have safeguards like for privacy and
Yeah.
all that.
Every user has a password that they should never share.
So it's not like on TV when they like hack into the computer system and change somebody's chart.
Right.
That doesn't really happen.
Not really.
Okay.
They have lots of security
It's good to know.
to keep people out. Right. So whether you're doing it on paper or on a computer, really the key takeaways are the same.
Yeah. Be accurate.
Yeah.
Be thorough. Be professional.
Yeah. And they say that it's a legal document.
It is.
So, I mean, it really does have some serious consequences.
Yeah. Consequences.
So you've got to treat it with the utmost
respect
and care.
and care.
Okay.
Yeah.
This is actually much more complex than I thought it was going to be.
It is. It's way more than just filling out forms.
Yeah, it is.
Yeah, it's a skill that takes practice, attention to detail, and a deep understanding of ethical considerations.
Oh, okay.
It's just something else we'll talk about.
Oh, all right. So let's dive into that.
Let's do.
Let's keep going with this deep dive, and let's see how these observations and charts actually play out in a clinical setting.
Let's do it.
I'm excited.
All right.
Here we go.
Let's go. All right, so welcome back. We're continuing our deep dive into observation and charting for nurse assistants.
I'm excited for this.
And now we're going to explore how all this stuff that we talked about in the last section actually plays out in real-life situations.
Right, because it's one thing to, like, learn about all the procedures and the codes and all that.
Right.
But it's another thing to actually, like, apply it.
And you're in the thick of it.
Yeah, in a busy clinical setting.
Absolutely.
Yeah.
So let's imagine, okay, you're a nurse assistant and you're helping a patient with their morning routine.
Okay.
What are some key things you should be observing and noting in the chart?
Well, first of all, I would think, like, their overall appearance. Like, do they look rested? Are they pale? Are there any signs of pain? Like, just kind of
Exactly.
their demeanor.
Yeah, go beyond just looking.
Yeah.
Actually interact with them, ask them questions. Like, how are you feeling this morning?
Right.
Did you sleep well?
Right. Because those questions can reveal a lot
They can.
about how they're doing.
Yeah. And remember those subjective observations?
Oh, yeah.
Like what the patient reports?
Yeah.
You want to document that in the chart using their words as much as possible.
So, like, if they say, I feel a little shaky this morning, you just write that down.
Exactly as they said it.
Okay, okay.
And then in addition to those subjective observations,
Yeah.
you would also be making your objective observations.
Yeah.
Like not things like their vital signs, their level of mobility, any assistance that they require with things like bathing or dressing.
Right. So if they need help getting out of bed, putting their clothes on, like documenting.
All of it.
Yeah, all that. So really just like painting a full picture.
Of what's going on.
Yeah.
So the healthcare team can make informed decisions.
Right. Okay. Now, what if they notice something that's like unusual? Like, let's say they have like a new bruise or they seem a little confused or something like that.
Communication is key.
Yeah.
Okay. You need to report any significant change in a patient's condition to the licensed nurse immediately.
So it's not enough to just like write it down in the chart.
No, you got to tell somebody
Okay. Okay.
verbally.
Right. Because then the nurse can kind of figure out.
Yeah, assess the situation.
Yeah.
And see if any further actions needed.
Right. So it's like a chain of
It is.
communication.
Yeah.
Yeah.
Ensuring that any potential problems are addressed.
Right.
You know.
Quickly and efficiently.
Yes. And that timely reporting can sometimes even be life-saving.
Oh, wow.
You know. They actually highlight this in the curriculum
Okay.
with a story about this nurse assistant who noticed a change in a patient's breathing pattern.
Oh, yeah. I remember that story.
And the patient's breathing had become shallow and irregular,
Yeah.
but there weren't any other obvious signs of distress.
Right.
But the nurse assistant, trusting their instincts and their training,
Yeah.
immediately alerted the nurse.
Right.
And it turned out that the patient was developing pneumonia.
Right.
And because they caught it so early and reported it,
Right.
the patient got prompt treatment
Yeah.
and avoided serious complications.
Wow.
So that's a good example.
It's a good example.
And how important
Yeah. How the little things
Yeah.
that you notice.
can make a huge impact.
Yeah. That's crazy. So it's not even just about being observant. It's also about trusting your gut
It is.
and communicate in that
It is. Yeah.
to the nurse.
Absolutely. Yeah.
Like, so we talked about communication with the nurse,
Right.
but are there other situations where you need to communicate with other people on the healthcare team?
Oh, yeah, all the time.
Yeah.
Like you might need to communicate with the physical therapists, the occupational therapists,
Right.
the speech therapists, the dietitians,
Right.
social workers, all kinds of people
So it's really about like making sure everyone's,
on the same page.
yeah, and that the information's flowing.
Yes,
Okay. And then what about communicate with the patient themselves?
that's huge.
Yeah.
That's a big part of your role as a nurse assistant.
Okay.
Building a trusting relationship with your patients is so important for providing compassionate care.
Okay. So really it's not even just about like the clinical skills. It's about,
Soft skills.
yeah, the communication skills.
Yeah, being a good communicator
Yeah.
can make a patient feel heard and understood and respected, and that can have a really big impact on their well-being.
Yeah. Okay. Now let's talk about some common mistakes that maybe nurse assistants make when they're documenting stuff. Because we've talked about accuracy, but I feel like,
Even experienced nurse assistants
yeah.
can make mistakes, especially when it's a really busy, fast-paced
Yeah.
healthcare setting.
Yeah. What are some things that people should try to avoid?
So one common mistake is failing to chart promptly.
Oh,
They really emphasize in here, document your observations and your care as soon as possible after they happen.
so don't wait till like the end of your shift and be like, okay, what did I do today?
No,
Yeah. Okay.
because your memory's not
Yeah,
going
you're
to
going to forget stuff.
pass clear.
Right.
Yeah,
It's probably less stressful too if you just do it right away.
it is.
Okay. What else?
Another common mistake is using vague language
Okay.
or non-specific language.
Yeah.
So instead of saying like, patient seems to be in pain,
Yeah.
you want to be more descriptive,
Right.
more specific.
So instead of seems to be in pain, you would say patient is grimacing and holding their abdomen or whatever, reports pain level of 8 out of 10.
Bingo.
Yeah.
There you go.
Okay.
And you want to use, whenever possible,
Yeah.
objective data to support those subjective observations.
Right. So if they're saying like, I feel feverish, you check their temperature
Check it, write it down.
and write it down.
Yeah.
Okay. That makes sense.
And then another potential pitfall is a practice called charting by exception.
Charting by exception. I don't know if I've heard that.
So what that means is
Yeah.
you only chart abnormal or unusual findings,
Okay.
assuming that everything else is within normal limits.
So like if their vital signs are normal,
Yeah.
you don't necessarily need to chart it.
Right,
Okay.
unless something changes.
Mm.
It's supposed to streamline charting and focus on documenting deviations from the norm.
Right. But doesn't that like create a risk of missing stuff?
It does. That's
Yeah.
why it's really important to document any changes from the baseline,
Right.
even if those changes are within the normal range.
So if their blood pressure usually runs low, but then it suddenly spikes,
Write it down.
even if it's still normal for most people.
Yeah, you want to write it down.
Okay. So you really have to know like what's normal for them.
Yeah, what their baseline is.
Yeah. Okay. So charting by exception can be a helpful tool,
It can.
but
You got to be careful.
you gotta be careful.
You got to pay attention to detail.
Right. Okay. And then what about like missing information? Because if you're only charting like the abnormal stuff, you might
Yeah.
forget to chart other things that are important.
Like, for example, let's say a patient refuses to take their medication.
Yeah.
That's something that needs to be documented,
Yeah.
even if their vital signs are stable.
Right.
Or if a patient expresses anxiety about an upcoming procedure,
Yeah.
you would want to chart that,
Right.
even if their behavior is otherwise normal.
So sometimes the important stuff isn't like the super,
Obvious.
obvious.
Right.
Right. It's about the little things too.
It is.
Yeah.
You want to capture the nuances
Yeah.
of the patient's experience. Okay.
And they talk about documenting patient education, which I was kind of curious
Mhm.
about. Like, why is that so important?
It serves several important purposes.
Okay.
So first of all, it provides a record of what information has been shared with the patient, how it was taught, and the patient's understanding of it.
So like if you taught them about a new medication
Yeah.
or wound care,
Write it all down.
write it all down.
Yeah.
Okay.
And this documentation helps to ensure continuity of care. So if another healthcare provider takes over,
Right.
they can refer to the chart and see what's already been done.
Yeah, it's like a
Like-
learning log almost.
It is.
Did the patient...
It is, yeah. And it's also legal protection for healthcare providers.
Oh, okay.
So if a patient later claims that they weren't properly informed about something,
Right.
the chart can be used as evidence.
Right, so it protects everyone.
Everyone.
Yeah.
And then documenting patient education can also help improve patient outcomes.
Oh, okay. How so?
Well, when patients are actively involved in their care
Yeah.
and they understand what's happening,
Right.
They're more likely to comply with treatment plans and make positive lifestyle changes.
So it's not just about, like, checking a box. It's about actually helping them get better.
Exactly.
Okay.
It's about empowering them
Yeah.
to take ownership of their own health.
I'm glad we talked about all these practical
Yeah, me too. And
applications of...
it's more clear now
Yeah.
how all this stuff translates into
Yeah.
real world.
Yeah.
Yeah.
It makes you realize, like, how much responsibility
Yeah.
really comes with this
Yeah.
law.
Yeah. Nurse assistants are handling a lot of sensitive information.
Yeah, they are. So that kind of brings us to, like, the ethical side of things,
Exactly.
which I think is what we're going to talk about.
Yes, the ethical considerations surrounding patient information.
Yeah, let's get into that. So let's talk about, like, the ethical considerations around, like, patient information.
Yeah, this is important stuff.
Yeah. It's a lot of responsibility.
It is, because as we've been talking about,
Yeah.
a patient's chart has a ton of personal information in it.
Yeah.
Sensitive information.
Right.
And protecting that information is not just a legal requirement.
Yeah.
It's like a core ethical principle for anyone working in healthcare.
Right. And they really stress, like, confidentiality a
Yeah.
lot in this curriculum.
Big time. Big time.
Because they say, like, you only have access to information about the patients you're directly caring for.
Exactly. I mean, imagine if you were the patient.
Right.
Would you want your information being discussed or accessed by somebody who wasn't involved in your care?
No, absolutely not. It's about respecting their privacy
Yes.
and treating their information, like, with care.
Exactly. And that respect for confidentiality goes beyond just, like, avoiding gossip.
Right.
You know, it also means being mindful of how you're discussing patients, even with other healthcare professionals.
So, like, what are some things that you shouldn't do?
Well, they specifically talk about not discussing patient information in public areas
Oh, right.
where it could be overheard by unauthorized people.
Yeah.
So, like, don't have a casual conversation about a patient's condition out in the hallway
Right.
or in the break room.
Yeah. Even if you think you're being quiet.
Yeah, you never know who's listening.
Yeah.
Right. And then this principle also extends to written and electronic records.
Right. So don't leave their chart, like, sitting out.
Yeah, don't leave it open on a countertop.
Yeah. Don't share passwords for...
Don't share your passwords.
Yeah.
Never.
Right.
And especially with computers and mobile devices being used more and more these days,
Yeah.
you got to be super careful about protecting that information.
Yeah. It's like loose lips sink ships. But in this case, it's
Yeah.
loose lips violate.
Violate patient privacy.
Right. Yeah.
Yeah.
It does make you wonder, like, all the new technology and stuff, how...
Oh, it gets tricky.
Yeah.
It's really complicated,
It does.
you know, because
Yeah.
we're kind of in uncharted territory when it comes to patient privacy in the digital age,
Right.
you know, so.
Yeah. It's like a balance of using the technology, but also...
But also protecting their information.
Yeah.
And it's an ongoing challenge.
Right. So
Yeah.
I guess it's really about, like, staying up to date on, like,
On this.
the best practices and...
And luckily, there's a ton of resources out there
Yeah.
for nurse assistants to
Yeah.
kind of help them stay on top of that.
Awesome. Well, this has been so interesting. I feel like I learned a lot.
Me too. It's fascinating, isn't it?
It is. Like, this whole world of observation and charting,
Yeah.
I didn't realize there was so much to it.
There's a lot more to it than meets the eye.
Yeah. And I also feel like this really highlights, like, the importance,
Of a nurse assistant.
yeah, of a nurse assistant's role.
They're the front lines. They're providing compassionate care.
Yeah.
Their sharp observations.
Yeah.
And their accurate documentation.
Yeah.
Makes all the difference
Big time.
in a patient's experience.
Yeah, totally. So to all the nurse assistants out there,
We applaud you.
yeah, thank you.
We appreciate you.
Thank you for all your hard work.
Keep up the great work.
Yeah. And for all of you listening, we hope this deep dive has given you kind of a better understanding of, like, the ins and outs of observation and charting,
Yes.
but also, like, the ethical considerations that come along with this role.
Absolutely. It's a big deal.
It is. As we wrap up, we want to leave you with a final thought to ponder.
Ooh, I like that.
Yeah. How can we make sure that patient privacy and data security remains a top priority as technology continues to evolve?
Because it's gonna
Yeah.
it's gonna keep changing.
Yeah. That's a good question.
It is. It's something that we all need to be talking about
Yeah.
as we kind of move into the future of healthcare.
Yeah, for sure.
Yeah.
Well, thanks for joining us today.
Thanks, everyone.
We hope you'll join us again as we explore more interesting topics together.
See you next time.